What's up, everybody? Nurse Jared here, and in this video, we're going to study that diabetes mellitus lecture deck that we created throughout our series. Before we get started, though, I want to show you what it's going to look like when you import this file in to Anki after you've got it downloaded. So what you want to do is you come up here to File, and we're going to hit Import, and then it should be in your downloads if you just downloaded the deck. But this will be the file that you'll see, the Anki deck package. So we'll just click on Nursing Without Notes deck and we'll open it up. And I'm not going to do that because I've already got it in here. But this is going to import your deck into Anki here. So now for future reference, if you do want to share your own decks or custom cards or save them for backup, what you can do is you click on these little gear icons out here to the left, and then you can export those to wherever you'd like. And depending on what you want to do, like if you have multiple decks underneath a main deck, you can export them all, or you can do them individually. So let's say, for instance, that you just started a new class in nursing school, and this is going to be Unit 1, and everything you're studying here is going to be on one test, but diabetes mellitus is what you're studying now. So what I like to do, outside of my university school nursing deck that I have here, I keep the current class folder separate. So let me go ahead and just say current class here. And let's make a deck, and then let's just go ahead and just move diabetes mellitus underneath that. And so that way we're just studying everything for the current class and not interleaving anything else that might be in our other deck that we've made, assuming you're further along in your nursing journey. So this is our current class we're in, and this is what we're studying. We just got through with our lecture, and now we're going to study diabetes mellitus. And before we do that, though, I want to talk about the settings real quick. Now, I don't get very deep or detailed in the settings of the decks, but I do want to show you what I do. So on the daily limits, I keep everything maxed out, 9,999. I want to see everything that's in that deck. If I'm studying that currently, I want that to be there. I'll show you how I would set the settings on the main deck here in a bit. But whatever you're studying on that deck, you want that to be maxed out. You don't want to not see any information. Because if you're studying diabetes mellitus, you don't want to see just 10 cards. Like, you need to see everything. So I keep all these maxed out here on the daily limits. Now on the new cards, I don't change any of these settings. I found that the default settings here with Anki are perfectly fine, especially with the way I kind of do things. By all means, play around with this if you'd like, but I've found no issue with the default settings. However, the only thing I do change is the insertion order, and I change this to random. And that's because I want to see things at different times and really hone in on that interleaving part of learning information, because I don't want to be able to guess what's coming next. You want to see different cards at different times, and that way you can really test yourself on the information. So I keep this at random on all decks. And bear in mind, you can change the options of all these decks to be specific for each one if you'd like. So I keep that the same. So 9,999 maxed out here. I don't touch this. I keep this on random. And then everything else I found to be pretty A-okay for me. And like I said, you can get down a big rabbit hole in all this other stuff. I don't touch that, and I changed these two things. So with that said, let's study diabetes mellitus, and we're going to pretend, or I'm going to pretend that I'm studying for this course. I just got out of lecture yesterday or the day before. I've got my deck made now. And now I'm sitting down for the first time, and I'm going to go through my deck and learn this information. So let's jump in. And also I'm going to kind of talk you through, like, I'm going to kind of word out how I'm thinking and answering the questions and voice all this. Just know that You don't have to do this while you're studying on your own. You can obviously do this in your head. But I think it's very important as you're going through each question to really dig that information up and then kind of make connections to the surrounding information and kind of Feynman technique, talk it out in your head if you can. I'm going to try to voice that to the best of my ability today for you. But just know as you're going through there, you really want to think about the information. You don't want to just recognize these cards. You want to actually be able to talk about it and put it out there like you were telling somebody that didn't know anything about it. So let's jump into diabetes mellitus. And then we're going to click that and then study now. We got 169 new. We should be pretty familiar with the information on this first run rather, if we just got through making the deck. So it shouldn't be too bad. But as you can notice here, I recorded this lecture back here, and it's somewhere back in October. So I've purposely not revisited this material for a while just so I can get kind of a more authentic run through of this, as if I don't really know it that well. So forgive me if I hit wrong too many times, but we'll see how it goes. All right, diabetes mellitus. Study now. And so what I like to do on this is I have the 10 key over here on the right side of the keyboard, and I just kind of keep my hands on the 1, 2, 3, and 4 with my index through pinky. And I find this to be very helpful when I'm just trying to run through these cards. So when should the patient test for urine ketones when sick? Well, I think that's going to be whenever their blood glucose is over 200. They're going to need to check that. Okay, I got that wrong. That's 240. So I'm going to hit 1, and I'm going to see that again. So 240. How much honey or syrup is 15 grams of carbs? I think that's 5 milliliters. Oh, 1 tablespoon, 15 milliliters. Okay. NPH. Onsets 1 hour, 2 hours. Peaks 4 to 6. Duration 12. Way off. Guys, it's been a few months. 1.5. Peak 4 to 12 hours. 16 to 24. Okay. All right. What should clients do before high intensity exercise or if they haven't eaten recently? Well, they need to check their blood sugars before, during, and after exercise. Have a carbohydrate snack. When should the patient test for urine ketones when sick? All right, so now that I got that wrong, I'm seeing it again real quick here. So they need to do it if the blood glucose is over 240. Good. So now I'm going to hit good on that. It's definitely not easy. I'm just now learning it again. So 8. And we know this one, we're back. This is 15 milliliters or 1 tablespoon. What protein does the beta cells and the pancreas secrete to lower blood glucose? Insulin, rather. NPH. So this is 1.5 as the onset, 6 to 8 peak, 12 to 16 to 24 duration, 4 to 12 peak. Okay, we got that wrong. We'll do it again. What should clients do before high intensity exercise or if they haven't eaten recently? Have a carb snack. What protein does the beta cells in the pancreas secrete to lower blood glucose? That is insulin. All right, so now we've got our image occlusion here. Fasting glucose, 70 to 110, 110 to 160, over 200. Way off. Under 100 for fasting, 100 to 125 for pre-diabetes, 126 or higher. All right. And guys, y'all got to know I haven't seen this material in months, so forgive me. I want this to be as authentic as I possibly can do it. All right. 100, under 100, 100 to 125, 126 or higher. All right, well, we're going to hit 1. Get that wrong. Oral glucose tolerance test, 2-hour postprandial. It's indicative of diabetes. I don't know it. I'm just going to flip. That's 2. All right. What oral glucose tolerance test value is indicative of diabetes? It's over 200. So I didn't get that right. NPH now. NPH onset's 1.5 and peak is 6 to 8. Duration 16 to 24. 4 to 12. Okay. 4 to 12. Fasting blood glucose normal range is under 100, 100 to 126 pre-diabetes, and over 126 is diabetes. Okay, good. What are the integument clinical manifestations of hypoglycemia? Cold and clammy. Awesome. When are oral anti-diabetic medications typically considered for type 2? Whenever diet and exercise won't work. High blood glucose levels or reduced blood flow, and reduced blood flow can lead to the development of which severe complication in the foot? That is diabetic foot ulcer. Oh, okay. Indicative of diabetes is 200, 1.5, 4 to 12, and then 16 to 24. Why is lactic acidosis a concern with metformin? Because it inhibits cellular mitochondrial respiration. Inhibits mitochondrial respiration. For females, what level defines low HDL as a risk factor for metabolic syndrome? Don't know. Less than 50. Okay. What fasting blood glucose is indicative of diabetes? Over 126. What should clients do after intense exercise? Monitor their blood glucose for 24 hours following. What is the minimum recommended exercise for individuals with diabetes? 15 minutes, 30 minutes a day, 5 days a week, 150 minutes. At least 150 minutes of moderate intensity aerobic activity per week, or 75 minutes of vigorous exercise. It's better over 3 days. This is diabetic foot ulcers, back, Lispro. Onset's 15, peak 1 hour to 2 hours, 2 to 4 duration. Okay, 15 minute onset, 30 minutes to an hour and a half, peak, duration 5. What is essential to monitor during meals and snacks for diabetes management? Oh, carbs. Duh. For females, what low HDL? Low HDL is less than 50 for. Okay. Metformin. We're going to avoid alcohol and report any signs and symptoms of lactic acidosis and stop that medication. What should the patient do before putting on their shoes? Check for any foreign objects. I'm going to hit 4 on this one just because this is a very easy card. It's just to remind us. So if I hit 4, that's going to go into 5 days. The next time we'll see that. What is the minimum recommended exercise for individuals with diabetes? 150 minutes per week, 75 minutes per week, or spread over 3 days. All right. 15 minutes 30 minutes to hour and a half, and then 2 to 4 hours, 5 hours. Hit wrong. What is essential to monitor as carb? Don't hit easy. HDL for females, low, it's under 50. A1C range for pre-diabetes, that is, let's see, 5.7 to 6.4. Okay. What origin does type 1 diabetes have, indicating its cause is linked to the body's defense mechanism, or defense system? It's an autoimmune disorder that results in the destruction of the beta cells, causing no insulin secretion. That's correct. What electrolyte moves into the cell with glucose when insulin acts on the cell membrane? That's potassium. What type of diabetes evolves gradually over an individual's lifetime and is characterized by insulin resistance? That's type 2. I'm going to hit easy on that. I know that. When should patients test for urine ketones when sick? Now that's back to that first one we missed. Now that's back to the first one that I missed. That's when glucose is over 240. 15 minutes, 30 minutes to an hour and a half, and 5-hour duration. All right, finally. For females, what waist circumference measurement is considered a risk factor for metabolic syndrome? Let's see. I don't remember. 35 or more. Okay. Pre-diabetes, A1C, 4.7 to 6.4. 5.7 to 6.4. All right, hit wrong. Or again, rather. Where is insulin typically administered, and how can absorption variability be reduced? You need to do it 2 inches from the navel and rotate sites. How much regular non-diet soda is 15 grams of water? 4 ounces? Yep, 4 ounces or 120 milliliters. Half a cup. What should clients do before high-intensity exercise, or if they haven't eaten recently? A carb snack? Should the patient wear sandals and go barefoot? Heck no. That's easy, obviously. A bit more. How many of the listed risk factors must an individual exhibit for a diagnosis of metabolic syndrome? I need 3 of them. What protein does the beta cells in the pancreas secrete to lower the blood glucose? That is insulin. For females, the waist circumference, 35 or more. Microvascular complications encompass those are the neuropathy, nephropathy, and neuropathy. What A1C range is indicative of prediabetes? 5.7 to 6.4. All right, now we're rolling. And the honey or syrup, that's that 1 tablespoon, 15 mLs. Why does the body resort to lipolysis and proteolysis during hyperglycemia? Well, the body's not tapping into it. The glucose isn't getting into the cells, and therefore it's resorting to breaking down proteins and fat molecules in that adipose tissue to get glucose. So that's why. Because glucose is unable to enter cells and generate sufficient ATP. What safety tips should patients taking oral anti-diabetic medications follow regarding OTC medications? Always consult a physician whenever you're taking OTC medications with any prescribed medication. That's pretty much across the board. How does the dosage of oral anti-diabetic medications usually initiated and adjusted? Usually start off real low, and you want to go to the lowest effective dose. Initiate a low dose for 1 to 2 weeks. Okay. I'm going to hit wrong. Do that again. Saltines, 6 saltines. How many candies? 6 to 10. What tailors nutrition recommendations for diabetes, and what factors are considered? That's a registered dietitian. Which nutrients do not break down into glucose and are less impactful on blood glucose levels? Fats and proteins, and that's where that proteolysis and lipolysis comes into play. Are ketones typically found in cases of hypoglycemia? No, that's usually a hyperglycemia. What are the five conditions in metabolic syndrome? Low HDL, high LDL, increased waist circumference, hypertension, and increased fasting glucose. Okay. I'll hit again on that. How is the dosage of oral anti-diabetic medications usually initiated, Justin? Start off low dose, 1 to 2 weeks, lowest effective dose. Second, medication or insulin therapy may be added if needed. Okay. 1 cup is 8 ounces. 1 ounce is 30 milliliters. 5 milliliters is 1 teaspoon. 1 tablespoon is 3 teaspoons. Proteins and lipids, or rather, proteins and fats, rather. What is considered high triglycerides in the context of metabolic syndrome? Risk factors? And that's going to be over 150, okay. How many grams? 3 gram carries. I'll do it again. What saying describes the appearance of individuals with hyperglycemia? Hot and dry sugar high. What are the general clinical manifestations of hypoglycemia? It's going to be confusion, weakness, headache, weakness, fatigue, blurred or double vision. Okay. What are the 5 conditions in metabolic syndrome? Those are hypertension, low HDL, high LDL, increased waist circumference, and increased fasting blood glucose and large waist circumference. All right. How is the dosage of oral anti-diabetics usually initiated? So we're going to start off low dose, 1 to 2 weeks, and then lowest effective dose used, and then may have to add another oral anti-diabetic or insulin therapy may be needed. What are the integument clinical manifestations of hypoglycemia? It's just cold, clammy. What is considered high triglyceride levels in the context of metabolic syndrome? That is over 150. 3 graham crackers, under 100, 120, 100 to 126, over 126. Weakness, fatigue, blurred or double vision for the hypoglycemia. When are the oral antidiabetic considered for type 2? When diet and exercise aren't effective. NPH 1.5, 4 to 1.5. Remember, 4 to 12, 16. Okay, I have to do that one again. What should clients do after intense exercise? You need to make sure they're monitoring for 24 hours frequently their blood glucose. Inhibits cellular respiration for the mitochondria, or mitochondrial respiration rather. Over 200, over 126, 4 ounces, 8 ounces, okay, get that wrong. When should new shoes be purchased? Later in the day. Hit 4 here for easy. Metformin, we're going to monitor for signs and symptoms of lactic acidosis and discontinue the medication if so. Good deal. High blood glucose levels and reduced blood flow develop. Okay, diabetic foot ulcers. 1.5, 4 to 12, and 16 to 24. What was the minimum? 150 minutes a week or 75 of intense or vigorous exercise over the spread of 3 days. Alright, what are the expected actions of metformin? Decreased absorption of glucose in the intestines, decreased synthesis of glucose by the liver, and increased insulin sensitivity. Alright, I'll have to do that one again. 8 ounces with the skim milk. What are the levels to find low HDL? 45? 50. 50 with the HDL, okay. What origin does type 1 diabetes have? It's autoimmune, it attacks the beta cells. 15 minutes, 30 minutes to 1.5 hours, and then 5-hour duration. Avoid alcohol, report any signs and symptoms of lactic acidosis, and stop for our metformin. What effect can alcohol have? It lowers waist circumference, 40 inches. 40 inches in males, 35. Why do individuals with hyperglycemia often appear flushed and dry? That's because all that water is leaving along with those with the glucose in the urine and that polyuria. So, decreased absorption in the intestine, decreased production of glucose in the liver, and increased insulin. Okay. Potassium, female HDL, 40, less than 50. Okay. What safety tip is crucial for patients with type 1? Always wear a medical alert. Maintain glucose to 100 to 250 and ensure no urine ketones. Okay. Waist circumference is 35 for females. For males, what waist circumference measurement is considered a risk factor? That's 40. 2 inches from the navel and rotate sides. How many of the listed risk factors must an individual exhibit for diet? 3. A1C over 6.5% or higher. Okay. 4 ounces. Yeah, 4 ounces or 120 mils. Decreased absorption of glucose in the intestines. Decreased synthesis of glucose by the liver, and then increased insulin sensitivity are the expected actions of metformin. Cool. Females HDL lower than 40, less than 50. Dang it. Okay, 50 female 50, female 50. What safety tip is crucial for patients with type 1 diabetes among aiming for vigorous exercise? Keep the glucose 100 to 250, no urine ketones. 8 ounces or 4 ounces of regular non-diet. Okay. Something under 200. 140 tonight. 190. Okay. Why should clients test their before their just to make sure that they're not exercising and using up too much energy and causing themselves to bottom their blood glucose out. A1C for pre-diabetes range is 5.7 to 6.4. Inspect your feet before putting on your shoes. Wash your feet with lukewarm water. Don't apply anything between the toes. Daily extra concern between the toes. Yep. For females lower than 50 HDL, they resort to lipolysis and proteolysis because they aren't able to use glucose, or they aren't able to get the glucose into the cells, so they revert to breaking down proteins and lipids as an energy source. 8 ounces, or 4 ounces. No. 140 to 199. Epinephrine and glucagon stimulate the liver when blood glucose levels plummet. What specific type of breathing does an individual experience in response to metabolic acidosis from hypoglycemia? It's Kussmaul's. Rapid deep Kussmaul's. All right, good. When conducting a urine analysis on clients with hypoglycemia, what will be detectable due to the utilization of lipolysis? We're just going to see ketones. How should the patient meet their nutrition requirements during sick days? Just eat soft food if you're not able to tolerate solids. Soft foods and liquids, okay. 4 ounces, 120 milliliters. Thank you. Do all individuals with diabetes need to exercise? No, this just is very dependent on their health. How do the lungs respond to metabolic acidosis caused by elevated ketone levels? How do the lungs respond to metabolic acidosis caused by elevated ketone levels in the blood? That is by rapid, deep Kussmaul breathing. To expel that carbon dioxide and restore pH to normal. Metformin administration, you don't crush the extended release, usually taken twice a day or once a night. BID with meals, morning, evening, don't crush, one evening meal. 5 conditions in metabolic syndrome: hypertension, low HDL, high triglycerides, increased fasting glucose, and large waist circumference. What risk does neuropathy pose for clients with diabetes during exercise? They're just going to be more at risk for injury because they're not going to be able to feel their feet, may fall, cut, skin breakdown. Neuropathy can lead to reduced pain sensation, putting client at risk for skin breakdown, joint damage. Yep. Which nutrients do not break down those proteins and lipids? What factors should be considered when personalizing meal plans for diabetes? Financial consideration, cultural, and food preferences. Yep, perfect. What accessory is recommended during exercise? We always wear a medical alert bracelet. How is the dosage of oral anti-diabetic medications usually initiated and adjusted? Start low dose for 1 to 2 weeks until the lowest effective dose, and then another oral anti-diabetic or insulin therapy may be added. What does scientific evidence not support regarding fixed ratios? It's just for diabetes management. there's no specific set ratio for carbs for any one or for all. It's very highly individualized. Hypoglycemia, we've got weakness, fatigue, blurred or double vision. Sugar packets, sugar is 15 grams of carbs. That is, is it 4 packets? 4 cubes or teaspoons. Okay. 15 grams of 15 rule. 15 grams of carbs, wait 15 minutes, recheck, give another 15 grams of carbs. If that doesn't work, then it goes on to the glucagon. Or 15 grams of fast-acting carb, wait 15 minutes, and then 15 more if less than 70. Okay. Monitor for lactic acidosis signs and symptoms. Discontinue if so. High triglycerides for metabolic syndromes. Over 150. Graham crackers, 3. Want to avoid the Valsalva maneuver with retinopathy. What is considered increased fasting glucose? Over 100. Yep. High triglyceride over 150. In the context of kidney-related complications, what conditions results in excessive albumin excretion, hypertension, and end-stage kidney disease? That's the Kimmel-Still-Wilson nodule or nodular glomerulosclerosis. A1C under 5.7, prediabetes 5.7 to 6.4, diabetes over 6.5%. 4 to 6, okay, 5.7, 6.4. Skim milk, 4 ounces. Oh, dang it, 8 ounces. 15 grams of carbs, wait 15 minutes, 15 more grams of carbs if under 70. General recommendation regarding no more, have it with meals, no more than 1 or 2 drinks. The absence of glucose, what metabolic proteolysis and lipolysis for our alternate metabolic pathways. Oh, lipolysis. What is reduced cellular response to insulin develops from diet and physical inactivity with possible genetic susceptibilities? Insulin sensitivity, or insulin resistance rather. What effect can alcohol have on blood glucose? It lowers blood glucose. NPH is 30 minutes or 1.5, 1.5, 4 to 12, 16 to 24. Yeah. How should clients maintain their glucose level during exercise? Just between 100 and 250, no ketones. Oh, that's for type 1. Keep glucose between 80 and 250, okay. 8 ounces on skim milk. Finally, good. Hyperglycemia, polydipsia, polyuria. 15 minutes, 30 minutes to 1.5 hours, and then 5 hours. This is going to be the tremors, shakiness, that tachycardia. Wow, they released that epinephrine. Oral glucose, over 200 is diabetes, 140 to 199 is pre-diabetes, under 140 is normal. Okay. Indicative over 6.5%. Diabetic retinopathy's appearance in the eyes due to restricted blood flow. That is from cotton wool spots. Hyperglycemia. The glucose is pulling that water along with it as it's being filtered through the kidneys, and polyuria. So we're going to have that dehydration. So it's going to give that appearance of flush and dry skin. How should clients maintain their blood glucose level during exercise? 80 to 250. polyuria, and polydipsia. Hyperglycemia, that thirst and urine output. Waist is 40 for men, over 40. Decreased absorption of that glucose in the intestines, decreased synthesis glucose by the liver, and increased insulin sensitivity. Even though the precise cause of type 2 remain unclear, what has been identified as a significant risk factor for its development, that's going to be the metabolic syndrome. What are the suspected causes of type 1? Genetic factors, and then obviously there's some talk about viruses such as mumps. Susceptibility genes, environmental factors such as 4 ounces of orange juice, which is 120 mils. Why might physicians prescribe a combination of different types of insulin? They're just trying to recreate the body's natural insulin release and try to replicate that. Regular insulin onset 15 minutes, peak 30 minutes to an hour and a half, duration 5 hours. Half hour, 2 to 4, 5 to 7. I'll hit again. For females, what defines that's going to be under 35? Oh, less than 50. That's circumference. Okay. Less than 50. When are they going to call the provider when they're sick? Persistent nausea and vomiting, moderate to large ketones, elevated glucose that doesn't resolve with treatment, and high temperature of 100.4 higher. How's the patient's insulin or medication regimen altered during sickness? They do not change anything with their medications when they're sick. What safety tip is crucial for patients with type 1 aiming for vigorous? That's the keep blood glucose 100, 250, no urine ketones. All right, good. Spec feed daily, wash with lukewarm water and soap. Don't apply a moisturizer, but not between the toes. Regular insulin, half hour, 1.5 to 3, 6 to 12. Half hour, 2 to 4, 5 to 7. What oral glucose tolerance test is indicative of prediabetes? 140 to 199. Low HDL, it's under 50. Is a normal value under 140 for oral glucose tolerance test. Random, I don't remember. Over 200 or higher, plus signs and symptoms of hyper. Okay. Metformin, we're just going to monitor for the lactic acidosis signs and symptoms and discontinue if so. Deposits can accumulate in the vessels and around their basement membranes, leading to which conditions? Hyaline arteriolosclerosis. Okay. At what blood glucose level does hyperglycemia occur? That's going to be above that 200. What specific type of breathing does an individual experience in response to metabolic acidosis from hyperglycemia? That's Kussmaul respirations. Non-soda is 4 ounces or 120. BID with meals or at night in the evening, the extended release, don't crush or chew. Regular insulin, half hour, 2 to 4, and then 5 to 7 duration. 2 hormones step into action, glucose and epinephrine step on the scene. How should the patient meet the nutrition requirements? Just soft foods or liquids if they can't tolerate solid foods. Over 200 for this random casual, and the classic signs and symptoms of hyperglycemia. Kussmaul again with the respirations and with the hyperglycemia. hyaline arteriolosclerosis for the deposits that accumulate around the vessels. Type of sock should, cotton socks. How much fluid should the patient consume during illness? Something every, assuming at least 4 ounces. Okay, every hour. Okay, do that again. How often should the patient monitor their blood glucose? Every 3 to 4 hours. Okay, good. What condition damages nerve cells due to high blood glucose concentration? Neuropathy. What is the pivotal factor in type 2 diabetes that emerges due to dietary choices, physical inactivity, and sometimes genetic predisposition? Insulin resistance. What risk does neuropathy pose for clients? It's just very unsafe. Skin breakdown, joint damage. Where should the patient not apply moisturizing cream? Definitely nothing between the toes. Why is foot inspection critical for clients with diabetes after exercising? It's just because they have that neuropathy. They're not able to feel, and they could get that skin breakdown, could lead to infection, and worse, if they can't heal, amputation. When the body lacks sufficient glucose, what general symptoms related to energy and vision might clients present with? Weakness, fatigue, headaches, blurred or double vision. All right. I'll hit again on that. How much fluid should the patient consume during illness? That's 4 ounces of 4 ounces of a liquid, non-caffeinated, every hour weight. 6 to 10 candy. 4 cubes or teaspoons. What process is triggered by elevated blood glucose levels where glucose molecules bind with proteins in them? That's that glycosylated, non-enzymatic glycation. It's been a minute. What does scientific evidence not support regarding fixed ratios for diabetes management? It's just there's no fixed ratios between carbs, proteins, and fats, and it's all highly individualized. Call upon that registered dietitian. What exercises should clients with retinopathy avoid and why? Anything with that Valsalva maneuver, they don't want to put pressure on the eyes that could cause a vitreous hemorrhage or anything of that nature. High triglycerides, over 150. When the body lacks sufficient glucose, what general symptoms related to energy and vision might clients present with? That's that weakness, fatigue, headaches, blurred or double vision. A1C under 5.7 to 6.4 pre-diabetes, over 6.5 for diabetes, 6.5 or higher. 4 cubes or teaspoons of sugar. What is a reduced cellular response? Insulin resistance. What is the general recommendation regarding alcohol consumption? Do it with meals and 1 to 2 drinks, with or shortly after. What process is triggered by elevated glucose levels where glucose molecules bind with proteins in the non-enzymatic glycation? What is considered an increased fasting glucose? It's over 100. What distinctive odor might be detected? That's going to be that ketone, that fruity odor that you're going to smell with hyperglycemia. 15-15-15 rule, 15 grams of carbs, wait 15 minutes. If it's still under 70, give 15 more. Benefits of exercise. Let's see, better blood glucose rate, lower insulin, increased insulin sensitivity. In the context of kidney-related complications, what condition results in excessive albumin, hypertension, end-stage kidney disease, nephropathy, or Kimmel-Steele-Wilson nodular glomerulosclerosis. In the absence of glucose, what metabolic pathway generates fuel for the body? Lipolysis. Under 140 to 199, over 200 for diabetes. cotton wool spots. 8 ounces for the skim milk. Never soak their feet if you're diabetic. What method can be recommended for diabetes management guidance? Diabetes plate method that you can recommend. They check that out online. What is the normal range for fasting glucose? It's 70 to 110? Under 110, okay. So we're going to have lowered insulin requirements, increased insulin sensitivity, weight loss, and better blood glucose regulation. What symptoms arise due to the release of epinephrine? That's that tachycardia, tremors, and shakiness. Metformin, the contraindications and predictions. You got severe sepsis or infection, chronic alcohol use, and then hypoxia. Okay. Lispro, 15 minutes, 30 to 1.5 hours, and then 5-hour duration. General clinical manifestations of hyperglycemia, flush and dry appearance, or polyuria and polydipsia. Random casual glucose, over 200, and classic signs and symptoms of hyperglycemia. What should you advise a patient to avoid using to warm themselves? That's heating blankets, heating pads, hot water bottles, portable, yeah. Can a diagnosis be made off of one test? No, usually they need to do it on different days to get a diagnosis. Normal range for fasting blood glucose under 100. The chronic complications associated with diabetes mellitus are mainly categorized into which two groups? Macro and micro. Chronic alcohol use, hypoxic states, and severe sepsis or infection. How often should the patient wash their feet and how? Daily, and you obviously need to pay close attention to between the toes and make sure to dry them thoroughly. Lukewarm water, and we're obviously checking that water with a thermometer and not our hands, our feet. How should clients maintain their blood glucose level during exercise? 80 to 250. What blood pressure reading is considered an indication of hypertension in the context of metabolic syndrome? Over 130? Over 130, exceeding 130 over 85, or taking antihypertensive medication. Okay. How many days should the patient wear the same shoes? Not any consecutive days. What cells in the pancreatic islets respond to elevated blood glucose level? It's beta cells. Females with a low HDL, that's 50. The NPH is 1.5 onset, 4 to 6 peak, 7 to 12 duration. 1.5, 4 to 12, 16, 44, okay. What are the adverse drug reactions to metformin? Let's see. Diarrhea, metallic. I'll hit again there. At what approximate glucose level does hypoglycemia occur? It's usually under 70. What is the normal value for oral glucose tolerance? That's under 140. When do you call the provider? Persistent nausea, vomiting, moderate to large urine ketones, elevated glucose that doesn't respond to treatment, and 100.5 or higher. The blood pressure readings, 130 over 85 is going to give us that, or taking antihypertensive medication. For males, 45 or less than 40. Okay, I'm doing it. How should the patient meet nutrition requirements? Liquid or soft foods if they can't tolerate. Fasting blood glucose is indicative of pre-diabetes. The 120 to 126, 125. What term refers to the heightened thirst experienced during hyperglycemia? That's that polydipsia. What are the adverse drug reactions to metformin? Nausea, vomiting, metallic tastes, and diarrhea. Okay. We're going to monitor for signs and symptoms of lactic acidosis and discontinue if so. Acute complications of diabetes mellitus. That's just hyperglycemia, hyperglycemic hyperosmolar state, and then DKA, hypoglycemia. Over 200 chronic classic signs and symptoms of hyperglycemia. What should be done before stepping into the bathtub? That's what we were saying earlier. Check with a thermometer, not your hand or foot. And it's under 110. Okay, need to hit again there. Regular 0.5, 2 to 4, 5 to 7. Okay, 30 minutes. Yeah, 30 minutes, 2 to 4. Lower than 40 for males on the HDL. Due to the release of which hormone do signs and symptoms of hypoglycemia rise? Less than 70? Or, release of which hormone? Epinephrine. At what blood glucose level does hyperglycemia? Over 200. What is the normal range for A1C? Under 5.7. So 4 to 6. What are the main types of macrovascular complications associated with diabetes? Cardiovascular, cerebrovascular, compromised immunity, and healing. Intense hunger during hypo, that's that polyphagia. Think phasia, eating, throat. What should be done before stepping into the bathroom? Check the temperature with thermometer under 110. Those happen at over 300 or over 200, over 600, over 300, and over 600. How can the severity of mental status change in hyperglycemia be described? Yeah, it's just all over the place, from alert to coma. Alright, what are the mental status in hypo? So, definitely got that irritability, confusion, nervousness. 4 ounces fruit juice, 4 ounces of soft drink, and 8 ounces of skim milk. Half an hour, 2 to 4, 5 to 7. Onsets 1 hour and then 24 length. 2 to 4. Okay, 24. Here, if we get severe hypoglycemia, we're going to administer that the glucagon, 1 milligram. Should individuals with diabetes wear sandals? Nope. Never. Why should only patients with healthy renal function, not prone to lactic acidosis, take metformin? Because that's everything that metformin does if you're not careful. Metformin disrupts the ability to reuptake lactate. Thus, if renal function is impaired, both metformin and lactic acidosis build up in the bloodstream. They're not excreted properly. Lactate will build up in the bloodstream. How can the severity of mental status change? Just from alert to coma. Process triggered by elevated blood glucose levels, where glucose molecules bind protein, non-enzymatic glycation. How much fluid should the patient consume during illness? You need to be drinking 4 ounces of sugar-free, non-caffeinated fluid every hour awake. 2 to 4 hours with the onset with the glargine, and then 24-hour duration. What you do if urine ketones are present? Don't exercise. Do not exercise if those ketones are present. Glargine, 2 to 4, 24 hours. How often should the patient daily extract between their toes? What cells in the pancreatic islet decrease? That's alpha cells releasing glucagon. How should the patient trim their nails? Straight across with emery board if possible. When should clients avoid exercising if they during the peak onset time and within that 1 hour? What should clients have handy during workouts? Just always have a little carb snack. What distinct odor? That's that ketone, that acetone fruity smell. What kind of therapy is essential for managing type 1 diabetes? That's just always going to be on insulin therapy all their life because their beta cells are not able to produce insulin like it should be. In extreme cases of diabetic foot ulcers, what procedure might become necessary? Amputation, that's the worst case scenario. Why is it important for older adults taking anti-diabetic medications to maintain consistent daily food intake? That's just to make sure that those drug levels and absorption rates all stay the same. And keep them stable. Sick day rules: notify the physician if ill, monitor glucose every 3 to 4 hours. If blood glucose is over 240, test for urine ketones. Okay, hit it again. Cool, clammy, and pallor for our hypoglycemia. So you're going to client education with metformin. You'll review the signs and symptoms of hyper and hypoglycemia. Explain it's not a cure, it's just a treatment, and teach them home management of hypoglycemia. All right, hypoglycemia here. Polyphagia, tachycardia, headache, and shakiness. What else? Monitor INOs and monitor lab values. Okay, hit again. What random blood glucose level is indicative of diabetes? Over 200 in classic signs and symptoms. Put on clean cotton, wear cotton socks, put on clean shoes, or do not wear the same shoes multiple days in a row, wear cotton socks, wear breathable shoes. Notify the provider if ill, monitor blood glucose every 3 to 4 hours, and if blood glucose is over 240, monitor for ketones. Nausea, vomiting, abdominal pain, and dehydration. Okay. So monitor eyes and nose, and then also our lab values like BUN, creatinine, B12, and BNP. Okay. Nausea, vomiting, diarrhea. Hypoglycemia, polyphagia, tachycardia, headache, shakiness, tremors. Decreased risk for cardiovascular disease, decreased blood pressure, improved cardiovascular function, and prevents ortholase type 2. Nursing interventions, we're going to monitor INOs and then also our lab values, BNP, BUN, creatinine, B12. Metformin, decreased B12. Okay, B12, folic acid, lactic acidosis. Personality change, seizures, coma. Just kind of flipping through the ones if I don't know it real quick. I flip it over to see the other side. That way I can give it a go on the next round. Just hit one. Nausea, vomiting, diarrhea, nausea, vomiting, abdominal pain, and dehydration. The blood pressure reading is considered 130 over 85, or the hypertensive medication. polyphagia, tachycardia, headache, and shakiness, tremors. Onsets 2 to 4, and then 4 to 12, and then 16 to 24. 1.5, okay. Decreased risk for cardiovascular disease, decreased blood pressure, improved glucose control, and then prevents type 2 cardiovascular function, okay. How should the patient meet their nutrition requirements? Soft, liquid foods, or if they're not able to tolerate. At what approximate glucose level does under 70? Tachycardia, or personality change, seizures, coma. Polyphagia, headache, tachycardia, and tremors. Fasting blood glucose range is indicative of prediabetes. 120 to 100 to 126, 125. 1.5, 4 to 12, and then 16 to 24. 6 to 10 hard candies, 4 cubes, teaspoons of sugar. Yep. Nausea, vomiting, diarrhea, metallic taste. Personality change, seizures, coma. Nausea, vomiting, or dehydration. Nausea, vomiting. Yeah. Normal A1C 4 to 6. Administer second dose, okay, after 10 minutes. Sick day rules: do not consume at least that 4 ounces of sugar-free, non-caffeinated liquid every hour away. Consume soft foods or liquid if solids are not handled. Do not stop taking insulin or other anti-diabetic. Do the release of which hormone? That is epinephrine. Nervousness, irritability, confusion. Nausea, vomiting, metallic taste. What term describes intense hunger often experienced during polydipsia, or polyphagia rather? Decreased B12 and folic acid and lactic acidosis. Administer 1 milligram of glucagon if those levels get below 20. At which glucose level does DKA? DKA is 300 over 600 HHS. Administer another dose in 10 minutes if still unconscious. Do not stop taking any of your medications. Consume at least 4 ounces of sugar-free, non-caffeinated liquid while awake, and then consume soft foods or liquids if solid food isn't tolerated. Trim nails straight across, buy new shoes later in the day, and then check shoes for foreign objects. Do not, you discontinue this medication 48 hours between any type of surgery or imaging test. Don't drink alcohol. 2 to 4, no peak, 24-hour duration. 6 saltines, 3 graham crackers, and 1 tablespoon of honey. Call 911 if those glucagon did not work, and follow their instructions. Do not go barefoot. Don't wear open-toed shoes or sandals, and don't soak your feet. Don't step into a bathtub without checking the temperature under 110. And never use any sort of hot water bottle, heating pad, or portable heaters. Don't avoid exercise within 1 hour taking insulin or during peak action time. So don't drink alcohol in metformin, and discontinue 48 hours before any imaging tests or surgery, especially with contrast media. You're going to review the signs and symptoms of hyper and hypoglycemia with the patient. Explain this is not a cure; it's just to help with the diabetes, and then you're going to teach them at home management of hypoglycemia. Monitor folic acid, B12. Monitor for lactic acid. Lab values. Put on clean cotton socks every day. Don't wear the same shoes consecutive days. And then wear comfortable, breathable shoes. Monitor for lab values in eyes and nose, BNP, bun, creatinine, B12. Notify the physician when you're ill. Monitor the glucose every 3 to 4 hours. If glucose is over 240, check for ketones. Polyphagia, tachycardia, headache, and tremors. Hyperglycemia, nausea, vomiting, abdominal pain, dehydration. Administer another milligram of glucagon after 10 minutes. They're still unconscious. Decreased folic acid and B12, lactic acid doses, adverse effect. Don't drink any alcohol. Discontinue with 48 hours before any imaging with contrast media or surgery. Do not go barefoot. Don't wear sandals. And then do not soak your feet. Okay. And nursing, monitor the eyes and nose, monitor the lab values for bun, BNP, creatinine, B12 while on metformin. Boom. All right. There we go. We did it. We got through our diabetes mellitus deck here on Anki. I'm going to hit sync. That's going to sync up our count, what we've done today. We can see that we just went through 355 cards, or the 169, I believe, but we did 355. We did that in an hour and 1.12 hours. Not too bad. So here's what I would do now. Like, you can leave this in rotation now that it's going. But before your test, what I like to do, instead of letting it go into the algorithm, what I'll do is, say I have a class tomorrow, I'll go ahead and create, let's say, the next topic or next class. So what I'll do is I'll go ahead and put this in my current class, and then I will start making the cards for the next topic after the next class. And then what I'll do at the top of each day, what I'll do is I'll come in here to browse, and I'll go to the deck. Let's see here. Let's go to the current class. I'll drop that down. And so what we just did, I'll select, now that we've got this highlighted, I'll select all these cards, and then I'll go through, drag all the way to the bottom. Now I've got all 169 highlighted, and I'll hit cards, and then I'll just hit forget. And this is going to put them back to the original position where possible. And so they're not going to be going back into the due dates, and depending on how you answered them, I just go ahead and reset. And so when we do that, now you can see we've got 169 new cards. And after I do this next topic, what I'll do is when I sit down to study again, after I go through the new topic by itself, I'll click on this deck right here. Then I'll study everything that's within it. And then I'll do that all the way up until the day of the test. And as soon as I'm done with this class for each unit, then that's when I'll move it into my main deck. And so what you'll end up having is this will be your university school nursing deck, and this will be the one you're working on. So if I changed anything in the settings, what I would do, so if you wanted to do your Anki, your reviews for everything you've learned throughout nursing school the whole time, what you could do is you could go in here and change options here on your main deck. And what you could do is maybe put new cards per day. Let's just say you want to see 10 new cards. And actually that can stack up pretty quick. I would just do something like 5 to 10 new cards every day and then save it just on that deck. And then what you're going to do is you'll end up having 10 new cards here every day, and then so you won't have to worry about the thousands of cards you'll end up having. So while you're studying this, you can just pop over throughout the day and then study, and then you'll keep up with everything you've learned throughout nursing school. Because if you try to do everything, like I wasn't able to really manage that as I was going through my nursing school. When I was in here, I was studying literally just unit by unit. And if you were to try to keep up with all your cards in review for the whole thing, you'd get completely overwhelmed and you'd never be able to have time to do anything. So what I recommend you focus on is just focus on unit per unit, what class you're on and what test you're on. Keep it all within that class. And then when it's done, move it over here. And then you can just set this to have a few cards a day. That way you can kind of stay on top of it, but it's not very overwhelming, and you can just do it. Like it's such a small amount, it won't bog you down because you're going to be so busy with your current class folder as is. So that's kind of how I did things. Obviously, completely up to you. But don't worry about the long-term space repetition so much in your current classes, because I like to go ahead and just reset these and then go through them again anyway. And then at the end, the day of and the morning of the test, I just go ahead and click on the entire current class, or the unit rather, that I'm working in, shall I say, that's going to be pertinent to the test. So I hope that helps you along your journey. Thanks for joining me on the Study With Me video. I know you're doing awesome. If you're already here, I guarantee you, I know you're crushing it. So good luck with your studies. Thank you so much for joining me here with Nursing Without Notes, and I look forward to seeing you in that next video.